How do you read an audiogram for hearing loss? Have you ever seen a graph and wondered what it means for your hearing? An audiogram is a visual representation of your hearing ability, showing the quietest sounds you can hear at various pitches and loudness levels. To understand how to read an audiogram, let's break it down step by step. First, look at the axes on the audiogram. The horizontal axis, or x-axis, represents frequency, measured in hertz. This ranges from low pitches on the left, like 1 to 5 hertz, to high pitches on the right, reaching up to 1,000 hertz. The vertical axis, or y-axis, shows hearing level in decibels. This measures loudness, with normal hearing thresholds at the top of the chart, around to 20 decibels. As you move down the chart, lower positions indicate greater hearing loss. Next, let's talk about thresholds. Each point plotted on the graph represents the softest sound you can hear at a specific frequency. If your thresholds fall between -10 to 25 decibels, that is considered normal hearing. Mild hearing loss is indicated by thresholds between 26 and 40 decibels. Moderate hearing loss shows thresholds from 41 to 55 decibels. If your thresholds are between 56 and 70 decibels, that indicates moderate severe hearing loss. Severe hearing loss is represented by thresholds from 71 to 90 decibels, while profound hearing loss is shown by thresholds greater than 90 decibels. Now let's look at the symbols used on the audiogram. Different symbols representing the left and right ears, as well as the type of sound delivery. For instance, circles often indicate right ear air conduction, while XS representing left ear air conduction. Bone conduction thresholds are marked differently, helping to identify the type of hearing loss. Speaking of types of hearing loss, there are 3 main categories. Sensorineural hearing loss indicates damage to the inner ear or auditory nerve, showing elevated thresholds for both air and bone conduction with little gap. Conductive hearing loss occurs due to problems in the outer or middle ear, showing normal bone conduction but elevated air conduction thresholds, creating an air-bone gap. Mixed hearing loss combines both types, with elevated thresholds for both air and bone conduction and an air-bone gap present. You might notice patterns in the audiogram. A flat line near the top suggests normal hearing. A downward sloping line toward higher frequencies is common in age-related hearing loss. Fluctuating or uneven lines may indicate hearing loss at specific frequencies. Understanding these details is crucial. Mild hearing loss may make it hard to hear quiet sounds or understand speech in noisy places. Moderate to severe hearing loss can significantly impact speech comprehension and may require hearing aids or other support. Profound hearing loss might mean you hear little to no sound without assistive devices. By analyzing the plotted thresholds across frequencies, you can determine the degree, type, and configuration of hearing loss. This information is vital for guiding diagnosis and treatment decisions. Always consult a qualified audiologist for a complete interpretation of your audiogram in the context of a full hearing evaluation.